Now to drug deals, insulin. It's the only medicine that can keep millions of people alive. And because companies are charging so much for it, people are having to make life and death decisions, struggling to afford the rising costs of everything else. More than 7 million people rely on insulin every day. The American Diabetes Association estimates a quarter of those people admit to rationing their insulin at some point. News4JAX consumer investigator Lauren Verno explains there are pushes to make this life-saving medicine more readily available. But Lauren, those impacted by the disease say it's just not enough.
It's not. And when you start to learn more and research this disease and the simple medicine it takes to let you live a normal life, it is just incredible to know where we are right now at this time. So I talked to a doctor who told me he has genuine fear when diagnosing someone with diabetes, specifically type 1, that they will not be able to afford their medication. And without it, they will die. That is a fact. So why more than a century after this cure was discovered are people still dying because they simply cannot afford it?
Hope it's not burnt.
Putting a price on a human life. Type 1 diabetic Phelan Schiltz says that's what drug makers are doing every day.
Without this, I die. If I don't buy it, I die.
Schiltz was diagnosed with type 1 diabetes at 14 years old.
Losing weight at a rapid, not natural pace, especially for being 14. Very tired, just all the symptoms, but we didn't know what it was. Rushed to the emergency room and had to start on insulin injections to stay alive.
And that would be the case for the rest of her life.
It affects typically kids, teenagers or young adults. But we see it in babies, we see it in older adults as well.
U of Health Jacksonville endocrinologist Dr. Gunjan Gandhi says it's important to understand there are actually 3 types of diabetes. He says gestational diabetes affects 10% of pregnant women in the U.S. every year. Then there's type 2 diabetes, which is the most commonly known and is largely associated with being overweight. And then there's type 1 that we've mentioned, but the exact cause remains a mystery.
There is some trigger. That trigger could be a virus. That trigger could be some environmental factor.
A type 1 diabetic is unable to create insulin on their own. Insulin is a vital hormone that regulates blood sugar in the body. Without it, the body will eventually break down its own fat and muscle. Realistically, you can die from this.
Absolutely. So people who have type 1 diabetes are dependent on insulin to survive.
So how much is one of those pens cost without insurance?
Without insurance, I think it's like $600. It's hundreds and hundreds of dollars a month with insurance. You have test strips, you have the needles that go on this, the monitor, just the alcohol swabs to clean, glucose tablets in case you have a low blood sugar, all the emergency supplies, the backup supplies.
So it's not surprising to hear when people are saying, I just can't afford this.
People are really contemplating, do I buy groceries or do I buy my insulin?
And that was never supposed to be the case. This scientist who created insulin more than a century ago sold the patent for $1, saying the hormone for battling diabetes belongs to the world.
From the late 90s, the cost has risen 1,000-fold.
3 pharmaceutical companies, Novo Nordisk, Sanofi Aventis, and Eli Lilly, control 90% of the insulin supply to the world. It's estimated it costs about $2 to $6 for these drug makers to produce a vial of this life-saving drug. Yet, it's sold for up to $1,000 per bottle. Do you ever get concerned when you're diagnosing someone that they're not going to be able to afford this medicine?
Yeah. So that's always in the back of my mind as a physician. You can see the anxiety. They get desperate, they're fearful.
And there are some resources Dr. Gandhi can offer to these patients, but they're limited. The 3 drug makers I mentioned earlier offer some coupons, but they don't cover everything and don't work if you have Medicare or Medicaid. Walmart offers one type of insulin at the, quote, low cost of almost $73 a vial. And even with insurance, Schiltz says it's a constant battle with the insurance company.
The copays also can change because the insurance companies control what they want to cover. One month this could be $25 for a few, the next month it could be $75, the next month they could say, we don't cover this anymore. It's crazy.
Which has left countless of families with those limited options. Do you believe that people have lost their life because they didn't have access to this insulin?
Yeah, absolutely. And, we have seen it. Yes, people have died.
And until something changes,
It's really, you pay or you die, a type of disease.
Joy, it really is scary stuff. And it's important to know with insulin, type 1 diabetics, they can live a very healthy and normal life. So Schultz, for example, she has 4 children and she experienced no issues during her pregnancy, which, is crazy already with 4 children, no problems, especially a type 1 diabetic. But again, that would not have been possible without her medication.
So, Lauren, is there anything being done to address this issue?
So a little. The Biden administration is pushing for a bill that would authorize Medicare to negotiate prescription drug prices, including insulin, and put a cap on insulin at $35. But it's only for people who have insurance, which would leave anyone without insurance back in the same situation they are now. Safe to say there is a long way to go. That's why tomorrow, starting at 7 a.m. on the morning show, we are helping you find the cheapest version for other prescription medications and revealing a warning from the Better Business Bureau to make sure you are not getting scammed. So I think a lot of people will benefit watching tomorrow morning. A lot of good information to help families save. I have to take a daily medication for something, and I looked on there because it's expensive. And if was some easy ways to try to lower those costs.
And it is such an important story with prices on everything increasing every time you turn around. The last thing that people really need is to have to make a decision about the medications that they need to survive. So thank you so much, Lauren.